Welcome to Expanding Access, a podcast by Behavioral Health Tech, where we explore the cutting edge of mental health, substance use, and autism and IDD care. Each episode features insightful conversations with industry leaders who are driving real change through technology and innovation. Whether you're a provider, payer, or just passionate about expanding access to behavioral health care, you won't want to miss these stories. Let's dive in. Hello, everyone. I'm Solome Tibabu, your host of the Expanding Access podcast, and I cannot wait to introduce our guest today. Thank you so much, Dr. Zach Boyd, joining us. To get started, maybe you can share a little bit about your background and your role, please.
Sure. My name's Zach Boyd. I'm probably a little bit of an unusual guest for this podcast because I'm trained as a mathematician rather than a behavioral health expert. I was trained and run a research program at Brigham Young University at the intersection of machine learning, behavioral science, and mathematical modeling. But right now I'm actually on leave from BYU, running the state of Utah's Office of Artificial Intelligence Policy, which, among many other things, is tackling behavioral health issues in a variety of ways in the state.
Incredible. I have so much I'd love to ask about that, but maybe even just to get started, all of these diverse research environments that you've worked in, Los Alamos National Laboratory, BYU, now state government, what has been the through line or motivation that has really guided this path?
The through line might just be that I like to try new things and get bored with doing the same thing all the time. So I was trained as a theoretical mathematician, which is a great foundation if you want to go do applied work, because it's really hard to learn deep theory in the field when you have deadlines. But then ever since then, throughout my PhD, and like you said, work on physics problems at Los Alamos, and then at Chapel Hill on social network problems, and now at BYU, I've just been kind of drifting towards trying to make a bigger impact and toward areas that I think are really interesting. I think from a mathematician's and modeler's perspective, social science is where it's at, because physics, in some sense, and physical systems are kind of a solved problem. We know the methodologies, we know mathematics works. It's just a matter of getting it to work in particular contexts. But social science is the Wild West. No one really knows how to get quantitative modeling to work really well in the social sciences, myself included. And I think that's really, really interesting.
What an exciting time right now, too. Looking back, would you have any advice for anyone, maybe even your younger self when you were first starting out in AI research?
Yeah, for me, the defining anxiety of being younger as a researcher was not knowing if I could do it, right? Just not knowing if you can make an impact. A lot of people, researchers and others, are trying to solve problems that have never been solved before and that maybe a lot of people have tried to do. And it turns out that just by cracking away at it for a long time and applying tools and kind of sharpening your mind over a few months, you can really make progress. So I think just a message of confidence that you can do it and you can chase the things that are interesting to you.
Just as we need so many behavioral health providers, this is also an area where there's a lot of opportunity for career paths and those want to pursue AI. So really good advice. Thank you for that. I want to go back to this very exciting title that you mentioned earlier, Director of Utah's Office of Artificial Intelligence. Can you share more about what that is and what are the most pressing challenges that you're facing and seeing in this space?
Sure. So the office was created to help Utah's regulatory structures adapt and change in an efficient way as AI rolls out through all elements of our society. And so on the one hand, this could mean helping the legislature craft additional consumer protections. On the other hand, it could mean clearing regulatory barriers. We've certainly talked to innovators in the state who are trying to innovate within the rules, but artificial intelligence is a paradigm-breaking technology, so sometimes we need to define new pathways for people to go down. And we also have very interesting authority from the legislature to create temporary waivers of regulations, specifically with companies that are trying to do things that are paradigm-breaking, and that will give us as a state a chance to observe new uses of AI and will inform our regulatory strategy moving forward without making all the companies in the state wait for the legislature to catch up and figure out what's going on before they're allowed to proceed.
That's really cool. And just the pace of things, necessary. How interesting. And for our audience background, can you share a little bit about how Utah's approach to AI policy differs from federal or maybe even other states?
Sure. I mean, everyone's been trying to figure this out for the last couple of years on the government level. I would say you've seen a few kind of broad approaches. One is kind of a very safety oriented approach that AI carries all kinds of risk. And I guess I won't pick out particular governments and their strategies, but other governments have been all forward on innovation and building new opportunities. And then others have kind of had the perspective that the best thing to do is nothing and just let the ecosystem develop. I would say Utah has taken elements from all three of these approaches. We do think that mistakes have been made over the last 30 or 40 years in tech policy, and it sometimes seems like there was no strategy, and now we're in a place that we don't necessarily want to be. So we do think consumer protection is important, but we do see real opportunity and we want to make a place for it. And we think that it's pretty doable for the government to balance these things. And that's kind of my office's job, is to lead out on defining and recommending a balanced approach that makes sense for the state.
Interesting. Now, speaking of this idea of clearing paths for novel business use cases, but also the balance you mentioned, you've really pioneered a lot of amazing work specifically around behavioral health and AI. Can you share with our audience some of the milestones taking place in Utah?
Sure. So last year, our first major push as an office was around behavioral health and AI. We kind of thought that this is the tip of the spear as far as AI impacting healthcare, because so much of behavioral health is language-based. And at that time, it was really unclear. Since then, I think our hypothesis has really been borne out that people love engaging with AI for their mental health in all kinds of ways. And so we surveyed that. We engaged with hundreds and hundreds of stakeholders from every aspect of the problem that we could think about, whether it was professional practitioners, people with lived experience, technology developers, community health organizations, just everyone we could think of. And we identified three key needs for Utah at that time. So one was a need for enhanced consumer protections around data privacy and around targeted ads. We basically saw that the way people were interacting with AI around mental health, they were sharing some of their most intimate experiences, and we didn't think the law was adequately protecting them in that context. So we advocated for that. Second, we advocated for education and clear expectations for our licensed professionals. We were finding licensees who were using AI in a way that could inadvertently harm people, but also many who are feeling held back because they just didn't know what professional expectations looked like in this new paradigm. And so we developed a giant 52 or 54 page guidance letter sent out to all of our licensed professionals outlining all the known use cases we'd seen so far and where we as the government felt like they were okay to innovate and where they needed to be cautious. And then lastly, we heard from our tech innovators, those who were actually trying to build the software and figure out how to apply it, that they were facing a super unclear regulatory environment. They didn't know if these AI tools were under professional licensure rules or FDA rules or consumer protection rules or some combination of the three. And so actually, the hardest part of this process was we managed to craft a safe harbor provision that defined, at least for now, what the state expects of these software developers, what constitutes responsible development. And in exchange for conforming to those principles, they get a relief from some of the regulations in the state that would have applied ambiguously to them.
That's incredible. I can't even imagine what went into that. What huge strides forward, though. Very exciting. Speaking of tech innovators, do you have an opinion around where some of the biggest opportunities might be, particularly for startups to leverage AI?
Well, I'm probably not the best person to advise a startup because there's so much interest going into this space. If I were going in, I'd want to make sure I was avoiding areas that were overcrowded right now. We definitely are hearing some pretty consistent stories from our innovators and from our practitioners about where the use cases are. First and foremost is in the back end stuff, automated note-taking, electronic health record fill out. That's a clear win. It will be rolling out in the coming years. It's already here anyways. Second, I think consumer-facing AI is really, really important, and people are probably underestimating how important it is. And in the news, sometimes you see a lot of these really sad and negative stories that happen when people's mental health or physical health is dramatically impacted negatively by AI. And those are real, but infrequent, but really high impact. What we're seeing right now for a lot of people is AI is straightforwardly useful to them for their mental health. We are finding populations seeking help more often, earlier, and generally getting pretty healthy feedback as a general matter. Again, there are these bad cases and people should be held accountable for those. But we're thinking of, like, to me, the dream of expanding therapy and healthcare modalities is so real. We're thinking just-in-time healthcare. We're thinking reminders for compliance. We've talked to companies who are doing at-home practice of coping skills in a controlled environment to help them grow along a therapeutic plan. Things like that, I think, are really, really interesting, and no one knows how that's going to turn out, but it seems like it's going to be really big.
You brought up such an important but challenging balance. And of course, I see those updates in the news as well. But we have to think about the alternative of making nothing available for the mental health crisis. A lot of those same outcomes are going to happen regardless. And so it is a tricky balance for sure. Maybe on that same thread, can you talk a little bit about how maybe communities and states can build more trust in AI, even as a result of these news updates?
Yeah, part of this is just going to take time. We're entering a period of experimentation, and no one really knows how all of it is going to turn out. I do think there are some things that we can do. From the government perspective, we do think adequate consumer protections are important. And specifically, in the bill that ran last year, the legislature they ended up agreeing with us that it's important to think of the market dynamics of who you're advantaging. So we basically, when we were crafting the bill, found all the people in the state who we thought were really smart and doing a really good job of this and asked them what their practices were. And we put that in a bill and said, you need to do those things. And all the people who we see in the news who are really irresponsible, who are causing all these harms, they're just not doing these best practices. And so before, the market was structurally favoring those who were moving fast and breaking things. And now the market is more structurally favoring those who are engaged in responsible practices. So I think that's a really, really important consideration.
It's a great approach for a lot of the states that can learn from your example. And Dr. Boyd, I realize, you're just getting started. You've got some exciting news on the horizon. Would you be willing to share a little bit about where your department continues to expand?
Well, yeah, there's a whole range of issues that we're tackling on an ongoing basis. We get new companies coming in every week for regulatory relief, and those are kind of natural experiments. Some of them are in behavioral health and some are not. But then also this year, we've got 2 new topics we're doing major studies on, and we're kind of getting closer to the end of those. One is on how the state should respond to deepfakes, which is not really a behavioral health thing, but then also how the state should respond to these AI companions and the rise of them. So we're seeing very rapid adoption of these companion technologies. You should think of these as like AI friends, AI girlfriends, AI role play, things like that. Some months ago, it was already at something like 1 in 5 young and emerging adults using these technologies. We're seeing statistics, very high rates of loneliness, likely an increase in loneliness over time among heavy users, not to mention elevated levels of mental health disorders, self-reported, and then these kind of edge cases of really, really negative outcomes where life is at risk and things like that. And so we're working with the legislature right now to craft bill language to basically turn this industry around, because we think the incentives right now, just the market structure is set up so that there's going to be a race to the bottom. We see the race to the bottom already happening. So we need to put some legislative floor in there to help this industry, which really is meeting a need in the sense that like people are going to these bots like crazy. Like there's just a lot of it, to make sure that turns into something we can be really happy with 10, 20 years down the road once it's matured.
Right. And going back to that theme earlier that you mentioned, for just even in tech in general, the frameworks that were established early on, just without a strategy, it's hard to go back and now let's set it on the right path from the get-go. Is there something that you wish providers, innovators, policymakers could understand a little bit more about as we craft that path forward?
Yeah, I mean, I guess one thing I would say I'll say 2 things to practitioners, I guess. I have interviewed so many smart people who are practitioners, and there are 2 things I would say. One is there are 3 public health priorities for behavioral health. There's safety, there's efficacy, and there's access. And I think so many people kind of naturally, when they see AI and it's new and it's strange, default to safety considerations. And those are real, but they're only one of the 3 legs. So like, for example, consumer-facing AI Yeah, sure. In many cases, maybe not as safe as being in the room with a licensed psychiatrist or something like that. But the access is like a huge issue too. So we'll have a decade of navigating these trade-offs and figuring out what we're most comfortable with. But we just need to keep these kind of three overarching priorities in our mind. The other anecdotal finding from our study last year is that we found, and I really want like a deep scientific study on this if someone wants to do it, but just in our population, we found that practitioners and people with lived experience were really far apart on their opinions about AI. That practitioners tended to be very safety oriented, very slow and cautious. And the people with lived experience that we interviewed uniformly said that they thought AI was a fantastic opportunity for them, and they felt very confident. Now, we know in some cases AI has done bad things, but that was their sense. It was that AI was an empowering technology to them. And so we'll have to think about why that opinion gap exists and what makes sense to close it. Maybe the providers need to listen more. Maybe people with lived experience need to be a little educated about the risks. But I think it's really important because the people making having the policy voices are the practitioners. People with lived experience tend to have less of a voice. And I think that's a really important consideration.
Yes, and something we talk a lot about at Behavioral Health Tech is, how can the folks who we're all looking to impact not be at the table in developing the solutions? And of course, AI is definitely an area where that comes up often. Really interesting. Thank you so much, Dr. Boyd. This has been super intriguing. Where can folks learn more about the developments that your department at Utah are continuing to achieve? How can we stay abreast of these bills?
Sure, you can go to our website at ai.utah.gov, and we post material there regularly. The legislative session is coming up in a couple of months, so I'm sure we'll have some bills to talk about as a result of that. But also, we're a small state and a small office. They can reach out directly to the email address ai@utah.gov, and we're happy to engage. We think a lot of communication is needed right now as norming happens throughout the community as we try and figure out what place this technology should have in our lives.
Amazing. So exciting to hear just the work that your team has pioneered, and super exciting. Thanks for taking the time to share with our audience.
Yeah, thank you very much. It's been a pleasure.
Thanks for tuning in to Expanding Access. We hope you're feeling inspired by today's discussion. If you've enjoyed the episode, subscribe and share it with your network. For more content and opportunities to get involved in transforming care, visit behavioralhealthtech.com. Until next time, let's keep pushing boundaries and expanding access together.